Yes, hello everybody. It's good to see that we have 121 participants, and thanks for joining us today. I'm Dr. C. Hui T. I'm a senior consultant, medical oncologist at the Parkway Cancer Center. And I've been with the Parkway Cancer Center now for more than a decade. And I've had the privilege of taking care of many patients with breast cancer, and quote unquote, many of them actually do grow old with us. And I'm just going to start the webinar in a short while. We still see quite a number of people who are streaming in. So we're just going to give a little bit more time. Today's webinar is a little bit more unusual because I'm going to share with everyone a topic which is of great interest to most of my patients. And in fact, we already have, Q&A streaming in already. We can definitely see that everybody's very interested in this. I'm going to start the webinar rolling with a small little introduction to what it means to be physically active and what's the difference between, being physically active and exercise. But of course, with the interest of time, there's only so much I can say in 15 minutes. And I would be more than happy to answer questions at the end. And I hope to do more videos with regards to physical activity exercises pertaining to different types of cancer. So, if you have many questions and you have any feedback for us, we will be really, really very appreciative if you can send us an email and tell us what you would like to see and what you would like to hear, and we'll try our very best to bring it to you. In a way, right now, everybody's talking about COVID-19. COVID-19 is a very important topic, and many lives have been lost, and many people's livelihood have been affected. But we always have to try and find a way out, and we always have to try and find that silver lining beyond that dark cloud. And one of the silver lining that I have found is that from the comforts of our home, we can actually share quite a bit with each other without actually being out there. So in that sense, it's kind of brought many people closer to one another. We could be really far away right now. I know that there are participants all the way from Bangladesh, from Vietnam, from Indonesia, and yet we're all right now focused on the computer, and we're so close to each other, and I'm talking to everybody. We still have quite a number of people who are streaming in. I'm gonna start slowly. And I'm going to share some of the slides in the insight with regards to physical activity and cancer and what's the deal. So here goes. So with physical activity and cancer, what's the deal? In this review, I'm just going to go through a little bit more about what is cancer and its known causes and the link between stress, cancer, and association with physical activity. Many of you might have heard of this before, but I just like to share with you that we do have people who have never heard of this, and they say, oh, well, I didn't know that if I was physically active, I could reduce my own risk of cancer and also to reduce the risk of cancer recurrence thereafter. And I want to just have some definitions as well. So let's just talk about cancer. What is cancer and how long does it take for it to develop? Cancer actually really takes anything from 10 to 20 years, and I know there are people in the audience who might disagree with me and say, no, I found my cancer really quickly and it was relatively aggressive. Yes, aggressive cancer can develop and can progress and can spread and kill within 6 months. Normally, these are the super aggressive cancers, but the seed of the cancer probably had been planted years before that. It really starts with a cell that has been cellularly damaged, whether by spontaneous mutation, carcinogens, infection by viruses, and of course, there's always that penultimate genetic mutation. And it can take 10 years to 20 years for it to show up in our body. And as we age, we collect more and more DNA damage. And as we age, our immune system would reduce and ultimately would be unable to fight any risk of cancer, and therefore cancer can develop. And we now know that also even with the control of obesity and some even say physical activity exercise can actually reduce the aggressiveness of the cancer even in the advanced stages. So cancer causation, these are some data from Singapore. The line that you see going rapidly up, that's breast cancer. And I probably think that there are quite a number of participants in this webinar who were survivors and are survivors, or who know people with breast cancer. So clearly with breast cancer, this is the #1 women's cancer, and we see quite a number of patients who are still suffering from breast cancer, and some say that certainly in Singapore it's now 1 in 13 to 14 ladies can get breast cancer. In the USA is as low as 1 in 6, 1 in 7 may have breast cancer. So the causes of cancer can be due to this thing called metabolic syndrome, which is truncal obesity. And if we can see here, breast cancer, what we see here on the left of the graph, this is called a forest plot. For those who are academics and say, oh, well, what is a forest plot? The forest plot, if we look at this line in the center, it is 1.0 relative risk. Anything on the right side of this line is greater risk. Anything on the left side of this line is lesser risk. So when we look at womb lining, endometrial, postmenopausal breast cancer per se, colorectal cancer, rectal cancer, liver cancer, ovarian cancer, all of these cancers are associated with a metabolic syndrome or obesity. And so that's one thing we need to put that in the back of our mind. The second thing I wanted to discuss is this thing about stress. You know, we always say, oh, is it because of my stress that I'm getting cancer? The definition of stress actually is any situation that's perceived as a threat. It could be an alarm bell that leads to an emotional outburst in this area called the hippocampus in our brain. It could be in the seat of our emotions. I'm emotionally stressed, and that leads to a physical response. And of course, there are these reticular activating system in our brain, and we always talk about that as the mind-body link. And of course, the hypothalamus, endocrine and autonomic, it actually supervises the endocrine responses to our stress. So there are people who stress, and there are people who react to stress. I could be having a lot of physical and emotional stress, but I may not be a reactor to a stressor. But I could have very little stress, but that little stress, if I'm a hot reactor, I could react to the stress with the all-out physiological reaction. Be angry easily, be anxious or depressed about the smallest thing, to the point whereby I get palpitations, irritable bowel syndrome, I need to go to the toilet very frequently, and I end up having nausea and vomiting because my stomach can't take the stress. So we could have little stress and have a huge reaction, or we can have a lot of emotional stress and have very little physical reaction. So this is all within our control. So the stress response, a few more definitions so that we can be very clear what we mean by that. Psychogenic and somatogenic. Psychogenic stress is a physical disease caused by an emotional stress without a microorganism involved. Somatic stress is a disease that results from the mind increasing the body's susceptibility to a disease-causing organism, natural degenerative processes, cancer, arthritis, so on and so forth. So obesity causes a lot of stress on the body. And of course, now there is a lot of data regarding obesity and how a person who's obese may have a decreased survival from even COVID-19. And the UK, the Prime Minister just announced that there might be control measures to reduce obesity in order to reduce the mortality from COVID-19, and the same thing with cancer. What about stress and immunology? The immune system consists of white cells, which belongs to you, what belongs to not to you. Whatever our white cells see that does not belong to us, it will seek and destroy. That's how strong our immune system can be. If you're a lung cancer survivor or you're a melanoma skin cancer survivor, you might have come across this word called checkpoint inhibitor, which is what we call an immunotherapy. This is a very in thing. It's all the new treatments, the targeted treatment against some very difficult to treat cancers. And these chemotherapies, targeted chemotherapy, actually enmesses our T cells to fight the cancer. So our stress and our immune system, if our immune system is poor, we can ill fight anything. If our immune system is strong, then it can fight quite a bit of things. Now, unfortunately, stress, physical and emotional stress that is ongoing and chronic can increase cortisol, which is a stress hormone that diverts the body's excessive properties to produce these stress hormones called catecholamines that can induce and reduce the white cell count, which would then lead to poor health and of course difficulty to fight cancer and any other illnesses. So how do we reduce stress? Through a diet and a good lifestyle. There are lifestyle choices. Adjuvant therapy of breast cancer can lower diseases mortality by 25 to 40%. Adjuvant being with chemotherapy, with medications, overall 25 to 40%. Weight maintenance after breast cancer can reduce disease mortality by 40%, but moderate exercises after breast cancer can further reduce the disease mortality by 40 to 50%. So there are quite a bit of people who says, no, I am born like that. Pessimists will conclude that there's nothing I can do about my weight, my stress, my lifestyle. Absolutely not true. There is a whole lot that we can do about our lifestyle and our weight. So I just also want to introduce this new concept as to what we mean by white adipose tissue. Are fat all the same? Why do we call it white fat and brown fat? I didn't put a slide in for brown fat, but brown fat is what we have in our neck and our upper body, which keeps us warm when we're very cold. This is the thing that starts to cause the shivering. If we go into a very cold country or where we walked into an air-conditioned room and we find ourselves shivering, the brown fat is activating. That actually burns in order to keep us warm and to keep our core temperature good so that we don't die of hypothermia. But there is this other more commonly known as white fat or white adipose tissue, which is usually collected around our trunk, around our underarms, around our hips. And there's a great balance. There's a whole lot of things that's going on in there. It is not an inactive tissue. It actually can induce insulin sensitivity. It's got lipid metabolism. It controls our cholesterol. It can actually even control and mitigate inflammation and acute phase responses, which again, of course, that can lead to poor immune system. And of course, in the end, higher risk of death from infections such as COVID-19 and from cancer. So when we have an increase in energy intake and a decrease in physical activity combined with a high glycemic index diet, that will lead to an increase in insulin, which will eventually increase in the cell proliferation from cancer and reduce cellular death from natural means such as apoptosis. And of course, in the very long run, that leads to tumor development. And truncal white fat, due to caloric excess, can actually make this process much worse, increase the inflammation, reduce our immune system, and it can make breast cancer much more aggressive. So unfortunately, when we have excessive good food, especially the sweet stuff, even fruits, even fruit juices, when we take too much of it and we don't end up burning it, unfortunately, it not only makes us feel heavy, it also has got some very, very active metabolic outcomes that are undesirable. So what is physical activity and this thing called metabolic equivalence of task? You know, we just so used to say, well, if I go out and run, I just go out and run. We don't think so much about it. But we have to tell ourselves that putting these things into definition is important, because whenever I tell my patients or my friends and family, can you please go and exercise and do some physical activity? They will always ask me, how much is enough? What do you mean by physical activity? So physical activity is movements that uses muscles that requires more energy than resting, including walking, running, dancing, biking, swimming, performing household chores, exercising, and engaging in leisure sports activities. This is very different from focus training for an athlete. It's very, very different. 1 MET is the rate of energy expended by a person sitting at rest. Like intensity activities expends less than 3 METs, moderate intensity 3 to 6, vigorous activity 6 or more. And sedentary behavior is any waking behavior characterized by an energy expenditure of 1.5 or fewer METs. Usually office work, like what I'm doing right now, driving a vehicle and sitting while watching television, and most of us would fall asleep. Most of what we know about the physical activity and cancer risk relationship is observational, but they're very strong. It can lower the levels of hormones such as estrogen and growth hormones that have been associated with cancer development, even in colon cancer. It can prevent high blood levels of insulin, which can be linked to cancer development and progression. So basically, if we keep physically active, insulin cannot be produced. So that's why we always say that after a meal, it's good to walk around because that can reduce the blood level of insulin, and therefore we can reduce the deposition of adipose tissue in response to the food that we eat. It can reduce inflammation and improve immunity, and it reduces the time it takes for the food to travel from the stomach to the intestines, which can reduce the high level of insulin. Of course, it can help to prevent obesity, and the word is help to prevent obesity, because if I were to go out and be physically active for 2 hours and I end up eating a 2-hour buffet, then it does not help to prevent obesity. In fact, it will probably make it worse because I end up eating more. So of course, obesity is a risk factor of an illness and cancer progression. So what do we know about the relationship between physical activity and cancer risk? I'm more than happy to share these slides with you so that you can see the details. But if you just glance at all these slides, there are several meta-analysis, which is a collection of several cohort observational studies, some even more than 100 of studies, where individuals, when they compare people with no cancer, who are the least physical active versus the most physically active, there is a reduction of 20 to 21% in all types of cancers. Breast cancer is 12 to 21%, 19% for colon cancer. And I'd just like to point out this focus on the breast cancer, because when a lady is inactive premenopausally and they are turning postmenopausal, it is still not too late to become physically active, even if they do it after the menopause, and that can reduce the risk of breast cancer. Womb cancer reduces by 20%, esophageal also 20%, and kidney cancer 12%. Even all these have shown that we can reduce the risk of cancer even in leisure activity. So this is not talking about very, very high intensity exercise or training. Even in bladder cancer, it can reduce by 13 to 15%, and in stomach cancer, 19%. Interestingly, in lung cancer, 25 observational studies that showed that physical activity was associated with reduced risk of lung cancer among former and current smokers, but not associated with the risk of lung cancer among never smokers. This is the part about the lifestyle change. If I'm running or I'm doing a physical activity, I end up not reaching for that cigarette. That act alone can reduce the risk of lung cancer in previous smokers. So what about physical activity beneficial for cancer survivors? Very strong evidence that moderate intensity aerobic training or resistant exercises during and after cancer treatment can reduce anxiety, depressive symptoms, fatigue, and improve health-related QOLs, or quality of life and physical function, bone health, as well as sleep. Now, again, specific cancers, breast cancer, colorectal cancers. Why specifically these three cancers? Why breast cancer, colorectal, and prostate? Because breast cancer, colorectal, and prostate are well known to be related to hormones. Hormones in intestines, hormones in the body, and all these meta-analysis or observational studies and epidemiological studies have shown that they at least reduce 1/3 of death from any cause and from specific cancer causes if we just engage in physical activity. So these are some of the observational cohort studies. But if you look at this graph right now, we want to advocate exercise, but we don't want to advocate too much exercise. So there seems to be this bell-shaped curve where breast cancer mortality can go up when we do more than 24 med hours per week. So there is this thing called doing too much. Same thing with this talking about BMI. If we can actually reduce our weight and our BMI, we can actually maintain the risk and reduce the risk of cancer occurrence. And of course, mortality curve by exercise levels, the more we exercise, the lower the mortality. So, but there are some questions we haven't answered, and there are several randomized studies that are underway on the topic of physical activity and cancer, focusing on reducing bias. Basically, people think, no, if I'm physically active, I definitely am healthier, therefore I will survive my cancer and I will reduce my own risk of cancer. But clearly, maybe this is all biased. So ongoing studies or randomized studies are here to answer what are the mechanisms by which physical activity reduces cancer risk, what is the optimal time in life, intensity, duration, is sedentary behavior associated with increased risk of cancer, so on and so forth. This is one of the only studies that has been shown. It's a very academic slide, But essentially, this is a group of individuals who was given physical prescribed activity during their chemotherapy. And again, I introduced this concept of the forest graph. This conclusion was that people who were given a prescribed exercise regimen during their chemotherapy did better. So exercise reduces stress. If we exercise, that's the #1 way of reducing stress. We can have fun. We can choose our reaction, as I mentioned, to reduce stress. If I have a small stressor, I can just brush it off. If I have a big stressor, I can choose to reduce it. But the worst that we can do for ourselves is to create a mountain out of a molehill. If it's something that is small, don't make it big. And finally, how much physical activity is recommended? Actually is 150 to 300 minutes of moderate intensity, or 75 to 100 minutes of vigorous aerobic activity, muscle strengthening activities at least 2 days a week, balance training in addition to aerobic and muscle strengthening activity. So that's really not a lot. If we're talking about 150 to 300 minutes per week, we're talking about 20 to 30 minutes per day. And that includes running after the bus 3 times a day. So that's really not a lot. So I hope that this is a simple introduction to physical activity in cancer. Because time does not permit, I'm going to go on and showcase what I would mean by a simple way of just getting loose, your muscles loose. I've got Eleanor with me. She's a trainer, and she'll take over from here.